Hello, my name is Nicole Lewinsky, and my capstone project is titled Equity Across the Breast Cancer Care Continuum, a Population Health Informatics Solution for Wayne County, Michigan. As an oncology nurse, I have cared for patients whose disparities or treatment was delayed because of barriers outside the healthcare setting, such as transportation challenges, financial hardship, and other social determinants of health. Those experiences inspired this project and the idea that healthcare informatics may help recognize population health challenges earlier before they affect the course of someone's breast cancer care. Despite considerable progress in breast cancer care, disparities in outcomes persist among vulnerable populations. I selected Wayne County, Michigan because its geographic and socioeconomic diversity provides a meaningful setting to examine these inequities. My capstone proposes a conceptual population health equity dashboard that integrates clinical, demographic, geographic, financial, and social determinants of health data into a unified view. The goal is to improve visibility of disparities across the breast cancer care continuum and support earlier recognition and targeted intervention. A comprehensive literature review and synthesis of evidence informed the development of the conceptual dashboard and key performance indicators. A SWOT analysis, stakeholder analysis, and failure mode and effects analysis examined organizational readiness, stakeholder involvement, and potential implementation risks. The proposed dashboard demonstrates how population health data may be transformed into actionable insights to support more timely and equitable breast cancer care. The executive overview was designed to support organizational leadership and strategic decision-making. It provides population health key performance indicators across screening, diagnosis, and treatment, along with geographic disparities and social determinants of health. These measures allow leaders to identify trends, gaps in care, and populations or geographic areas that may require additional resources or intervention. The Nurse Navigator view brings that same information closer to the point of care coordination. It emphasizes overdue follow-ups, referrals, appointments, treatment delays, and barriers such as transportation, housing, and insurance. By presenting these measures in one centralized view, nurse navigators may be better able to prioritize outreach, coordinate services, and identify barriers that could delay care. Both views utilize the same underlying population health information, but the data are organized differently to support each end user's responsibilities and workflow. This role-based approach allows healthcare teams to work from a centralized source of information while receiving the insights most relevant to their individual roles. 3 analyses evaluated critical factors that could influence future implementation of the proposed dashboard. The SWOT analysis identified strengths such as integrated data architecture, earlier identification of disparities, role-specific decision support, and geographic visualization. It highlighted important challenges related to data quality, interoperability, user adoption, cybersecurity, and long-term sustainability. The stakeholder analysis demonstrated that successful implementation requires interdisciplinary involvement, executive leadership, population health providers, oncology clinicians, navigation, IT, and quality improvement teams were identified among stakeholders requiring close engagement. The failure mode and effects analysis examined potential risks throughout the proposed workflow. The example shown here highlights that incomplete or inaccurate documentation during clinical and social determinants of health screening could reduce accuracy of the patient risk profile and limit the ability to identify disparities. These analyses illustrate how successful implementation depends on technology and also on data quality, workflow integration, stakeholder engagement, and effective governance. As an oncology nurse, the patient's journey has always been the destination. Through this capstone, healthcare informatics became the vehicle for transforming complex data into meaningful information that may help make the journey more timely, coordinated, and equitable for the patient. Thank you.